I'm Dr. Fabio Faria, a Brazilian board-certified orthopedic surgeon with fellowship training in hip surgery. I have about 8 years experience in this field. Hip surgery is definitely the area that I'm most passionate about. It comprises joint replacement surgeries, arthroscopic surgeries of the hip, and other kinds of preservative procedures. I'm working at Axon Medical Clinic at Dubai Silicon Oasis. Here we have great facilities and an amazing team to provide you diagnostic evaluation and treatment for most of the orthopedic conditions, such as fractures or traumatic injuries, sports and overuse injuries, work-related conditions, degenerative conditions such as osteoarthritis, and osteometabolic conditions as well. Such as vitamin D deficiencies, for example, which are exceedingly common in the UAE. And whether you need just some advice, whether you need some specific medications or procedures such as joint injections, for example, physiotherapy, or maybe some more advanced treatments such as surgical procedures, we surely can help you. I'm really passionate about sports, and as an athlete myself, I try to understand the mindset of all my athletic patients. And I surely won't be the kind of doctor that will keep you away from your activity for such a long time. No matter if you're a recreational athlete or an elite level athlete, or maybe if you even has just some hobbies or other kind of activities that you really enjoy doing. It's one of the most satisfying things to see my patients resuming their full activities pain-free and regain their quality of life. One sport that has become very popular nowadays is running. I think it's a kind of a worldwide trend. Lots of people are engaging into that, people of all age groups, and they're engaging at several different levels of running. And lots of running-related injuries are very frequent in runners. So probably the most common is the patellofemoral syndrome, but we got also iliotibial syndrome, plantar fasciitis, which comes with great disability, shin splints, and probably the most feared ones are the stress fractures. Most of them are related to training errors. Okay, maybe you're running too fast or too often, or maybe you're not doing enough warm-up. The kind of surface that you're running is affects on that for sure. And the types of running shoes as well. Each of these conditions has specific recommendations and treatments. Runners tend to get used to feeling some pain, as these conditions are extremely frequent for these athletes. But you should avoid that. If you're feeling some pain, there might be something wrong. It can turn into a more severe injury. So what I would advise you is always look for your orthopedic surgeon. Interesting tip about running shoes. A recent study has shown that parallel use of different pairs of shoes seems to be a protective factor against running-related injuries. So, which means that if you have two pairs of running shoes that you like, maybe from different brands or just different models, it might be interesting for you to alternate them in between your training sessions. One frequently asked question from my patients is, can running cause osteoarthritis on my hips or in my knees? And the answer is actually no. Recent research has shown that there's no relation in between recreational running and hip or knee osteoarthritis. As a matter of fact, running seems to be a protective factor. Loading on the bone and the cartilage actually makes it stronger, and good muscle conditioning certainly is a factor as well that protects your joints from osteoarthritis. So, as orthopedic surgeons, we are the ones that will answer your questions. Is this pain serious? Can this turn into a more severe injury? We will also tell you if your specific injury requires some resting time or any specific type of treatment.